Of education and hands-on experience in Health Watch. Shelley Botat tells us how one local hospital is helping future paramedics get that experience by letting students shadow their emergency room doctors.
Aurora BayCare Medical Center has partnered with NWTC to give paramedic students real-world experience in an emergency room. The shadowing program helps them understand what happens after they deliver a patient to the hospital. Andy Lohman is learning firsthand how doctors assess and treat a patient once they hit Aurora BayCare Medical Center's emergency room, which is a level 2 trauma center.
I may never see some of the things, in this ER again in my career, so it's good to be here for that. Right
now, Andy is an advanced EMT and part-time sheriff's deputy.
I have a strong passion for helping people.
But Andy wanted to help more, so he enrolled in the paramedic program at NWTC.
Provide, advanced care to them, something that I couldn't do previously as an EMT.
Part of the program requires students to shadow a physician in the ER.
The idea was to try to make the paramedic students more well-rounded and try to teach them what are the physicians thinking when they bring patients to us, what are the questions that we're asking.
I believe that it will help by giving that extra, thought into what this patient's going to go through when they get to the hospital.
The program can open students' eyes to a diagnosis they may never have thought of.
As the students come and follow us and they see how the patient evolves and what the workup entails and what the final diagnosis is, the end point might be something completely different than what they had suspected in the beginning.
And compare that with the doctor and, see how close I am. I think that's going to be very beneficial in, helping diagnose, problems in the future in the field.
The shadowing can help students think outside the box when they are in the field.
Look at the bigger and the more broad picture and, what other questions could you ask or what else could you do while you're still at the patient's house
to provide the best care possible.
That's the whole goal, is to improve patient care.
And hopefully be able to save their life.
The shadowing program also helps build the relationships between the doctors and the EMS providers. To learn more, you can call Aurora BayCare or email HealthWatch at aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, local